Let's take a live look right now over Ann Arbor for you here on this Tuesday morning. The city is taking honors in several new rankings, saying that it is one of the best cities in which to live.
It's a high honor for the city of Ann Arbor being named most educated in America.
Ann Arbor draws people in because of the university, big football games, innovation, advancing just society.
Ann Arbor is definitely known as a city where you can raise a family and really live out this idea of an American dream. There's nothing you can't do in Ann Arbor. It's sort of like its own bubble in the state of Michigan.
You know, we have about 75% of what you get in a big city and about 15% of the problems. It's it's a great place to live.
This is a close-knit community, actually. It's a melting pot. Everyone comes here. Everyone is welcome. So now I actually call Ypsi my home.
Part of what does make Washtenaw County unique is, we're the sixth largest county in Michigan. So we are small but not tiny. And so that allows for you to have personal relationships with folks. Trust comes from relationships, competence, and follow through. And so that ability to have those actual relationships with people, I think are really, really important.
I mean, it's a destination place where people want to come. So it's a great place to be, but that also means that we have individuals that are unhoused that come here as well. Why? They want the same opportunities we all have. They want to be part of this great and vibrant community. So we need to find a way in which we can all live comfortably.
Like pretty much every community, I think, there are also a lot of folks who are struggling in Washtenaw County. And I would add that when you're in a community that has a lot of affluence, it almost makes it even harder for those folks who aren't seeing that affluence, who aren't participating in it.
What people don't see on the local level is the disparities in housing and kind of the haves and have-nots.
I think the public mostly is unaware that the folks who work at the university or at the hospital or at the restaurants downtown don't actually live in Ann Arbor because it's unaffordable.
A lot of it boils down to the systems that are in place. So when we talk about housing and homelessness, that's just one symptom of a much bigger problem.
It's often been said that being poor is incredibly expensive. Well, that is front and center in Washtenaw County, because people who are struggling economically, people who are poor, everything's more expensive. Whether it's housing or food or transportation, everything's more expensive, and you're also pushing up against those other folks who have more buying power.
We have lots of challenges, and you've described them. You also have the healthcare infrastructure that makes that provides challenges because people aren't able to access the healthcare that they need, the mental health services that they need, addiction support that they need. These are services, human services, that we know are crucial to keep people housed.
We are always full, and there is a waiting list that is usually between 120 and 130 families long. And no matter what we seem to do, all our community partners working together on this, it's never enough.
The Manchester Resource Center has been, to me, like life-saving, for sure. Yes, life-saving. The food alone has saved us numerous times. The fact that they offer, like household cleaning products and things like that. You take things for granted. Do you know that I haven't had salt on my food for 2 years? I don't take medications that I'm supposed to take. I don't go to the doctor anymore. And I'm disabled too, so.
Everybody's saying all this stuff is available, and it's not. I'm still here day 40. This is day 40. I'm still here doing the same thing. When this resource-rich county said, hey, if you go after these resources, we'll make them available to you. I've done that.
The bottom line is the bottom line. And so what's being done to make sure that that funding is sufficient? At the local level, there is an opportunity for local officials to put more money in at the local level. And I think Washtenaw County is actually, as frustrating as the current provision of housing services is in Washtenaw County. From what I can tell, Washtenaw County does a lot more of that than other counties. But despite that, we still have these huge holes.
For our purposes, the continuum of care is really positioned to support those that are experiencing homelessness according to HUD's definitions of homelessness. There's a third category that HUD gets to decide which communities pertain to that. So this is really like in the policy realm, but it's important to distinguish that because our call center, which is our front door to coordinated entry, it's how we get folks entered into our homeless management information system and identified so that we can triage them appropriately for services. We get calls from a lot of different people, and sometimes those people don't fit the criteria that we can support, unfortunately. And that's because for right now, at the time of this recording, we are primarily funded through the U.S. Department of Housing and Urban Development. We get $7.3 million on an annual basis, though it's really important to note that right now, that is the funding that's currently at jeopardy of being cut.
Let's keep in mind that affordable housing as an issue is not just the homeless population. It's the single mother, that couple, that small family that works, again, 40 hours a week and still can't afford a decent 2-bedroom, 3-bedroom apartment. Those are the families. Those are the folks on the edge. Those are the folks that we really want to get.
But the most important piece is that these folks that we're talking about, they get to be the navigator of where they want to go. We are there not to drag them and say, you got to do this. We are there to support, to engage, to lift up.
I called HALT program, and they told us about, I believe it's called Alpha House Shelter. We went there for the heating program, and we were living in the basement there and eating there. Basically, life was there. We loved it, and then we went to SOS Shelter House, which they gave us a house out in Ann Arbor. We was the first people to have the Ann Arbor housing, and then we came here to the Grove.
For my mental health, Ozone helped me out extremely because the staff there kind of became like family. Like they were working with us the whole entire time. Like when I transitioned to Miller House, staff there all the time. So like you build those relationships when you're in there. And it also provided me a safe space to heal, which was a huge thing because from my story, like up until I left, that's when I had really had time to sit and unpack all of my trauma.
It's really important that we, when we in Ann Arbor, work on what we're going to do with our housing in our little area, that we, keep an eye towards and ears towards the county and others, so that we integrate and coordinate.
In Michigan, the county boards, county governments don't really have the ability to supersede local units of government and their individual decisions about zoning. But we do have the ability to purchase land and forego any zoning requirements associated with that. And so while we can't tell them what to do, part of the way that we can be involved in the solution is to look at areas of the county that could be developed and purchase that land to make the development of that land a little bit easier for the need.
The continuum of care, I think the goal of collaboration is the right goal. I think the local nonprofits that are participating in the continuum of care are all bought in. But what isn't happening is the buy-in of local governments and other parts of our system are not as active in our continuum of care.
And I think one thing that makes us less effective is around leadership and collaboration.
If the local governments step up to take the place of the federal government, we could have a more flexible system. We could have a more one that's designed to meet the needs of our community rather than the entire United States. And we could reduce a lot of the regulatory barriers, but it would not be an insignificant amount of funding to replace the federal government.
It's really easy for the problem to become internalized and to want to point the finger. So just remembering that when time is really frustrating and there's tension rising and we feel like we're competing for resources and we're all under constraints for capacity, The problem is outside of us, and working together and staying in communication and staying in relationship with each other. That's how we're going to move through this.
The county, I hope, will step in and help do its part. But, this is not something the county can always do entirely on its own. All the old ways of doing things, of meeting the challenges, of responding to problems, those are in many ways off the board because we don't have the structural support coming from the state, and we certainly don't have it from the feds.
If we narrow our focus to just talking about housing policies, we're not getting to the real root of the problem. The real root of the problem is people's hearts. There's a real lack of compassion, of empathy, of understanding that we're all interconnected and interdependent.
We could have addressed these things in the 70s, the 80s, the 90s. Homelessness is not new in the 2000s. We've forgotten about these people for so long. Now we're seeing larger repercussions because there's affordable housing is no more. It's incredibly limited.
I've lost a little bit of hope, if I'm honest. I don't know.
I don't want to see another person go without their needs being met when there are resources available that I can see with my own eyes.
Ann Arbor and U of M has always been about innovation and change. There's a number of smart individuals that could help make this change, but we're lacking something, and it's not money.